Good morning, members, or good afternoon, actually, and welcome to our AAIP webinar. This is actually our last video webinar for this particular series of the new patient experience. So tonight we are going to watch this last video. This is on the patient accepting treatment, presenting the plan to the patient. But we will go over, as we always do afterwards, to go over different points of the video. So let's go to our video.
All right, Joyce, so what Dr. Sheldon was saying was you have a few options here. One option that you have is the implant. The second would be a bridge in the area. And the third would be something that would be removable. I'm guessing that you don't want anything removable. It's kind of it's one of those things that if you can't afford to do an implant or a bridge, you have to do it. It's better than nothing, but it is an option, so I do want to go over that with you.
Okay.
The first thing would be, of course, the best choice, and that would be a dental implant. And basically, this is going to show you what it is. An implant goes into the bone just like a root would go into the bone. It's an anchor that goes into the bone. It's actually a pretty simple surgery. It only takes about 20 minutes or so. The tooth's already out, so it doesn't need no extraction. So they just put the implant into the bone, and it actually will sit in the bone for a few months, so it will integrate, be part of your body. So for a few months, you're going to go just kind of how you're going now with nothing in the area.
Okay.
You did mention that we would do what's called an S6 appliance. It looks like a bleaching tray. It's clear, just pops on there at nighttime. And that's just to make sure that the teeth don't start to drift together. We want to keep that space that you have in there now. So the implant would go in, and it's sturdy into the bone, it's strong into the bone. It's made to be just as strong as the natural roots. So your eating habits would be the same. Everything would be the same. It'd feel the same. It's independent, so it doesn't break down or compromise the other teeth in the area.
Which is nice.
So it's the best option. You can still floss in here, and everything is independent. So of course, this is the best option to go. Implants are made to go in and stay in forever, and as long as you take care of them, come back for your cleanings with us, usually it does stick with you for the rest of your life. If this is something you don't want to do, you can do the bridge. And so usually the way a bridge works is, in your case, you have two healthy teeth, on either side of the missing tooth that you have here. So what they would do is they would actually grind down these teeth. They'd grind them down into like little pegs. And so it does compromise those teeth. It breaks them down a little bit. But what it would give you is a 3-unit bridge that would go into the area and give you a filled tooth. So you don't really have anything there. It's a fake tooth.
Right.
And so these would take all the stresses of this tooth because they have to do the work for this tooth. Looks nice, feels nice, but you can't floss in here anymore. You have to do like floss threaders in there. And then it does kind of break down these teeth to where they're not as strong. You've already taken away some tooth structure, and of course they're doing the work that this tooth would be doing. So that would be the second option if you want to do that. The third option would be, like we said, something that would be removable. Not ideal. If you can't afford it, you can't afford it. But removable would be something that kind of goes in there, comes out at night. Not made to eat with. It's not made to improve your chewing function. It's really just made to fill the gap, just to fill the spot. So that would be your third option there. Which one of those are more appealing to you?
I like the option of having an implant.
The implant.
I
That's
don't
what I would
really
choose as
want
well.
to touch the adjacent teeth.
Yes, and for your age as well, it's something that you would do now and not have to worry about again. So that would be, of course, the best option. And this is also another way to look at it here. I mean, you have the missing tooth in this area here, so instead of breaking down these two teeth in this area, which is kind of like this, a bridge, you're just going to replace this tooth, and so everything is all by itself in that area. So a much better choice there.
No.
Any questions on what an implant is or anything like that?
No, I'm just worried about the cost.
Okay, all right, and we'll go over that too. Get all this out of the way. Like I said, the implants only take about 20 minutes to do, and since when we are working with an implant, it is different stages. So the very first thing we're going to do is we're going to have you come in, and we're going to place the implant in the area. It is surgical, but a very quick surgical visit, 20 minutes or so. They're going to numb the area so you can't feel anything. And they put the implant in, and then we're going to give you that little clear S6 piece to keep the gap there. And it's going to also act as a Band-Aid for the first 24 hours, just so it doesn't hurt the touch of the tongue. So for that, we're talking 20 minutes or so. So from start to finish, getting you ready, about an hour. What day would be better for you to come and have that done?
Wednesdays work best for me.
Good. Okay. And what about, like I said, not very invasive. You can drive yourself. You can drive yourself home. We do have sedation options if you want to be sleeping during the procedure, but you are going to be numb. You're not going to feel anything. So unless you're really, really nervous about this, I'd recommend, of course, just getting it numb. But
I think I would be okay with not being sedated.
Perfect. All right, Joy. So the first thing I would have available, the very first Wednesday, you said, correct?
Yes.
That I would have available would be May 11th. Does that sound like a good day for you?
That works for me.
All right. And that would be in the morning. You drive here about 7:30 in the morning, and you should be done before 8:30, 9 o'clock or so.
Would I need pain medication for after?
Usually the best for this would be just over-the-counter Advil for this.
Okay.
It's really not as much as it sounds. It's pretty simple. Some people just go to work after this. It's not a very invasive procedure. For your case, in the area it is, there's a lot of bone in that area, so it shouldn't be something that's too difficult. But usually just Advil is fine for this.
Okay.
So I'm going to have put you on there. I'll have you for 7:30 on May 11th, and then we're just going to go over the paperwork for that. Okay?
Okay.
So what Dr. Sheldon was explaining is this here, and what we're going to do is we're going to be doing the implant in that area. He's going to be using the PRGF. You heard him say that. And with that, what they do is they do a blood draw. And they're using your blood. They spin it in a centrifuge, and they use all your rich platelets and plasma in the area to help with healing, integration of the implant, less downtime. So it's all your good stuff in that area. So we're going to do that and then place the implant. He's also going to do that tissue grafting. Remember he was explaining that?
Yes.
Okay, so the tissue grafting is where he's going to take some of your own tissue from the roof of your mouth and place it in that area just to give you some more bulk, some more tissue in that area.
Okay. Is that going to be painful?
It's not painful during the procedure, but afterwards it feels like a pizza burn on the roof of your mouth.
Okay.
And that will probably be the area that bothers you the most. But he's going to give you what he was calling the stent. It's a palatal stent. He puts it in the day of surgery, and you'll leave it in there for 24 hours. After that, you'll take it out slowly, rinse it, and put it back in. It's a Band-Aid that goes in there. And so usually for something like this, as long as you don't touch it and you stay away from it, it's fine.
Okay.
And then he will check you a few days afterwards, make sure everything is fine, and then we'll give you some follow-up on how to take care of that.
All right.
Okay? So we'll do the soft tissue grafting. This is the S6 appliance that's going to fill where the implant area is so the teeth don't go together. This is the palatal stent.
Okay.
And then once that implant is ready to be used as a crown a few months down the road, we're going to put in there a ceramic abutment. And the abutment is what's going to be able to connect the crown to the implant, because an implant is 3 parts. It's the implant, the abutment, and the crown. So we'll do that. And what we do at that time is something that's called an Austell Check. And it's a neat little wand that they touch to the implant to make sure it's integrated into the bone. And that way we know that the implant's ready to be used. If it's not quite yet integrated into the bone, then we shouldn't use it yet. That's how some implants fail, is that they get loaded too early. So we'll do that neat little test during that time, make sure all's good to go, and then we'll place the ceramic abutment. And the abutment, just so that you know when I'm saying this, you don't know the difference, some people use what's called a stock abutment. And this is it here. And you can see you have a lot of area around this abutment for stuff to get stuck down in there. And usually what gets stuck down in there is the cement from the crown when it goes to be cemented on there. This is what we use. We use a ceramic abutment. You can see it covers all that area, so there's not much that can be stuck around that area.
Much nicer.
Much nicer, yeah. Aesthetically, it looks nice, and it's a lot healthier.
Okay.
So that's what we're going to do there. So everything that you're going to have done there, this is your total here. It's $6,792. That's for the whole thing. This includes all your appointments, all your x-rays, everything until the treatment is completely finished. And you have that crown in there and you love it. It looks good. Okay?
And do I have to come up with all of that at one time?
Your options are this. One, you can do Care Credit.
Okay.
Care Credit is dental financing. And they give you 12 months to pay this off with no interest whatsoever. Okay. If you want smaller payments, you can go all the way out to 40 months or so and have smaller payments, but the no interest is neat because it's kind of like free money. So that's your first option there. Nothing down, just payments for 12 months.
Okay.
If you don't want to do that, you can do half down today and half 2 weeks before the procedure, and that way you can break it up a little bit. Or my favorite, you can do the 5% discount because it saves you $340. That's a lot of money there. So you can save that money, and then you just prepay for the entire thing. It's already done, paid for. You don't have to worry about money for the entire time that you're doing this procedure here. So that would be your third option. So which one's more comfortable for you?
I'd like to take advantage of saving
Perfect. That's
5%.
what I would do. I would do the same thing. Gas is getting expensive again, so it's a good savings.
Yes, it is.
Okay, so what we'll do there is I'm going to have you sign this saying that we went over all the steps of what's going to happen here. And signing here just explains to you that if there's anything you have to do additional along the way, we will pay for anything additional. We just want to make sure that we give you the final product that we have promised. Okay. The other important thing here is that We can't stress enough that you come back and see us for your routine maintenance, because we want to keep an eye on the implant. We want to make sure it's healthy. We want to make sure it's being cleaned out, and we can catch any problems early so that this implant can last you, hopefully, for the rest of your life. Okay? So just
Okay.
initial here saying you understand all this, and then sign here.
All right.
And I'm going to go over some consents for you, okay?
Okay.
These consents I'm going to go over, we'll go over basically the bone grafting, because he mentioned that you have to use some bottle bone in the area just to make
Yes.
sure that the implant is secure